Good morning, William Dobie. I am Mahira. Let's start the warm-up sessions. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities, both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Your preparation time is over. You can now start the role play.
Hello, good morning. My name is William, and I'm a nurse here in the emergency department. Can I get your name, please?
Hi, it's Mihira.
Hi, Mihira. What brings you to the emergency department today?
Well, I was chopping vegetables in the kitchen about an hour ago, and I accidentally cut my finger with the knife, and it's bleeding quite a bit.
I'm sorry to hear that. How severe is the bleeding? Has it slowed down, or is it still bleeding heavily?
It's still bleeding, though not as much as initially. I have a cloth wrapped around it.
And how about the pain? On a scale of 1 to 10, with 10 being the worst pain imaginable, how would you rate it?
It's around a 5. It's quite painful, but I can manage.
Have you done anything to care for the wound so far? Did you clean it or apply any antiseptic cream?
Yes, I rinsed it under water for a bit, but I haven't put any cream on it. I just wrapped it in a clean cloth.
All right. Have you taken any pain relief medication like ibuprofen or acetaminophen?
No, I haven't taken anything yet.
Okay. Thank you for the information, Mihira. I understand that you're in pain and worried about your injury. Let me explain the next steps so you know exactly what to expect and feel more at ease. First, I will gently clean your wound to remove any debris and reduce the risk of infection. This might sting a bit, but I'll be as careful as possible. After cleaning, we'll assess the wound to see the extent of the cut. Then, a doctor will come in to examine it more thoroughly. Based on the depth and nature of the cut, the doctor may decide that stitches are necessary. Stitches are important for closing the wound properly, which helps it heal faster and prevents infection. If the doctor prescribes it, we may also give you antibiotics to further prevent any infection. Additionally, we can provide you with pain medication to help manage your discomfort. I know this sounds like a lot, but these steps are all meant to ensure that your finger heals well and that you feel better as soon as possible. Do you have any questions or concerns about this process?
Stitches? I've never had stitches before. Are they necessary?
I understand your concern, Mihira. Stitches can sound a bit intimidating if you've never had them before. However, for a deep cut like yours, they play a crucial role in the healing process. Stitches help close the wound properly, which significantly reduces the risk of infection. When a wound is open, bacteria can enter and cause complications. By stitching it closed, we create a barrier that helps prevent this. Additionally, stitches promote better healing. They bring the edges of your cut together, which allows your tissue to reconnect more effectively. This not only speeds up the healing process, but also minimizes scarring. I know it can be a bit nerve-wracking, but I'll be here to support you through it. Do you have any specific concerns or questions about getting stitches?
That's reassuring. Nurse, I'm a bit worried about having a scar.
I understand your worry, Mihira. It's natural to be concerned about scarring. While it's true that scars can form as part of the healing process, I want to reassure you that most scars fade significantly over time. They often become much less noticeable as they heal and mature. There are also scar management creams and treatments available that can help minimize the appearance of scars. These can be applied once your wound has healed a bit more, and we can discuss those options with you to ensure you have the best possible outcome. Remember, the primary goal right now is to make sure your wound heals properly and safely. Once that's taken care of, we can focus on reducing any scarring. If you have any more questions or concerns, please let me know. I'm here to help.
That sounds like a plan. Thank you.
You're welcome, Mihira. The doctor will be here shortly to confirm the treatment and we'll get you taken care of.